This video training series is courtesy of the County of San Diego Office of Emergency Services.
Every emergency call, every emergency run, every life saved starts with you, the first responder.
But what do you do when confronted with evacuees with needs who may pose a challenge to your typical training methods?
The following video is one of a series of 8. It's designed to educate you on the various visual cues, do's and don'ts, proper behaviors, mannerisms, and sensitivities relating to those members of our San Diego community with cognitive disabilities.
Our hope is that you learn as much as you can so that when lives are depending on quick thinking and fast maneuvering, you have the knowledge and training to make the best decision possible.
Hi, Teresa. I'm Dan Green. I'm a captain for San Diego Fire Department. I'm here to ask you some questions about people with cognitive disabilities.
Thanks, Dan. I'm Teresa Dwight, and I am a speech pathologist here in San Diego. And I'm also the president of the San Diego Brain Injury Foundation.
What could have caused people to have cognitive disabilities?
Cognitive disabilities come from a variety of sources. They come from right CVAs or right-sided strokes. They come from traumatic brain injuries. They come from dementia processes like Alzheimer's. And so the range of the severity can go from something very mild to something very severe. Typically, persons with Alzheimer's have cognitive disabilities, but individuals with cognitive disabilities don't necessarily have Alzheimer's.
What are some of the common myths or stereotypes that people might assume individuals with cognitive disabilities have?
You know, that's an interesting question, that people assume that because they have cognitive disabilities that they also have dementia, and therefore their skills are not amenable to getting better, which is not true. We do cognitive rehabilitation therapy and people regain skills. The second thing that really riles them is that people assume that because they have cognitive disabilities, that speaking louder, it will help them process information faster, and it doesn't. Cognitive disabilities impact across ages. It's not just, the 30-year-old that had that motorcycle accident, and it's not just the Alzheimer's 90-year-old.
Fire department, anybody home?
How should a first responder communicate to an individual like this with cognitive disabilities to let them know that we need to evacuate and in a manner that they can understand?
Hello and welcome.
First responders are in a very difficult situation because when they come in, it's an urgent situation.
Hi, ma'am. My name's Kyle. I'm a firefighter. There's been a gas leak in your neighborhood, and we have to have you evacuate your home, okay? Can you come with me?
No, thank you.
Hold on, ma'am.
But when they first come in, what's important to the person is that they introduce themselves showing the badge so that the person with a cognitive disability recognizes concretely that they are a first responder and not just someone with a name, that they describe why they're there, that they use a voice that they would use with any other person, and that they let them know what's happening and what they're about to do before that action happens.
There's been an emergency, and we need to be able to have you come outside of your home, okay? Can I help you grab?
I'm not supposed to go anyplace.
I understand that, ma'am, but there's been an emergency. We need to have you come out of your home for your own safety. Okay?
So can you elaborate on some of the visual cues that a first responder might see when we're dealing with a person with cognitive disabilities?
What cognitive disabilities are problems with attention, how someone processes information, how they remember, and how they use that information to solve problems and to plan, and also to use those skills on the spot when they need it.
You want some lemonade?
The difficult thing is, unless there's a coexisting physical disability, it's very hard to tell that someone has a cognitive disability. A few of the red flags would be a delay in responding.
Do you need a purse? Do you have any medications, anything like that at all that I can get for you?
I'm not supposed to leave my house.
Or the inability to follow a train of thought. One example of something that a first responder can look for is a confused facial expression, because they're having a hard time adding up what all of these little pieces of an alarm going off, there's smoke, and coming to a decision about what all these means can be a very confusing process.
Do you have any medications that you can show me where they're at, or a purse?
You can't have my purse.
How about some medications?
The second behavior is to look for examples of short-term memory issues. This isn't information from long ago, like their date of birth. It's more like things that happened recently.
Come this way. This is my house.
Okay.
And that's my outside. And the lock on the door is there.
Okay, perfect. Looks like the door's already locked. Can we get your purse and maybe some medications of yours that you might have?
No. But thank you.
Well, we kind of need to get those so we can get you outside of the house, okay, ma'am?
Last thing to look for are signs of escalation or agitation. As that situation begins to grow, their ability to handle it isn't as efficient.
I was supposed to get you something.
So what happens is they start becoming restless, and that restlessness evolves into greater behaviors of resistance and eventually to combativeness.
Get you something, and it was important because.
Yes, ma'am.
When someone with a cognitive disability starts to escalate, the behavior that we witness is agitation. And that agitation can range from something as simple as not being able to sit still to somebody that's combative.
What are any do's and don'ts that we need to know?
I think the most important thing is that the person recognizes the urgency of the situation and that you're there to help them. To communicate that, it's important to get down to their level and describe things in very simple terms.
Is there anything else you need for us
All
to
right,
take?
bye-bye.
No, you have to come with me, ma'am, okay? My job is to get you out of the house, okay? 'Cause there
People
was an
assume that
emergency.
because they have cognitive disabilities, that speaking louder will help them process information faster, and it doesn't. And give instructions one by one instead of grouped into a series. Instead of saying, I need you to put your hand on my shoulder, step up so we can go out, each time they complete a step, introduce the next instruction. So if you were to give that direction, you could say, I need you to put your hand on my shoulder. So they do that.
I see. Be very
Then
specific.
Be very specific
I get
and
it.
wait for them to respond before the next instruction is given.
You're gonna follow me, okay?
You're gonna call my friend.
Yes, ma'am.
And the don'ts would be to not assume that what they say is 100% valid.
I'll get your door.
You're very nice.
Thank you, so are you, ma'am.
One of the landmarks with a person with a cognitive disability is that they have distortions in their understanding.
Do I need to do anything?
No,
The second thing is to not assume that once they are in an area considered safe, that they're going to stay in that area.
Here, stay
I'll
with
go
me,
help.
okay, ma'am?
I'll go help.
No, that's okay.
Another landmark of someone with a cognitive disability is that the brakes in that frontal lobe just doesn't work as effectively. So when they have an impulse, the ability to stop that impulse is not as effective as someone without a cognitive disability.
Is there a big fire?
No, there was just a gas leak in your neighborhood, and just as a precaution, we're getting everybody out of their homes, okay?
Precaution. Do you
Yeah.
want me to sit?
No, you don't have to
I can sit.
If you prefer.
I can sit. I can sit.
Okay, if you prefer to sit down on the ground, that's fine.
I can sit.
Thank you for everything you've talked about. You've really given us a lot of great information and really have informed us on how to deal with people with cognitive disabilities. Thank you very much.
You're welcome.
This concludes the cognitive disabilities video for first responders.
For more information, please contact the San Diego Brain Injury Foundation at 619-294-6541.
I'm Tony Meacham, San Diego County Fire Chief.
I'm Shelley Zimmerman, Chief of Police of the San Diego Police Department. Thank you for watching.